Next, we have Dr. Shahna, NA, with indications and outcome of transepithelial photorefractive keratectomy extra.
Good morning all. Our study is on indications and outcome of transepithelial photorefractive keratectomy extra. Transepithelial photorefractive keratectomy, it is an advanced surface ablation procedure where excimer laser smooth and regularizes the corneal focusing shape. TransPRK extra is enhanced with an additional corneal strengthening procedure called corneal collagen cross-linking. Rarely, thinner corneas may progress into a condition called corneal ectasia. So, TransPRK extra is postulated to reduce this risk by strengthening the cornea in high-risk cases. There is no definitive inclusion criteria for selecting the patients for TransPRK extra. So, our study is to evaluate this indication, safety, efficacy and refractive outcomes of TransPRK extra. This is a retrospective study done in 29 eyes of 16 patients in a 1-year period, and we included TransPRK extra for patient with a central corneal thickness of 450 to 475 micrometer and keratometry above 46 diopters with a suspicious topography. The data collected included patients' age, sex, ocular medical history, details of surgery and complications, and the refractive outcomes were recorded during post-op visits at 1 week, 1 month and 6 months. This is the procedure. Preoperatively, 1 drop of proparacaine was instilled. Using excimer laser, TransPRK was done. Following TransPRK, an accelerated corneal collagen cross-linking treatment was performed. The riboflavin solution used was 0.1% and the soaking time before the UV radiation was 90 seconds and the energy used is 2.7 joules per centimeter square, which is half the strength in conventional corneal collagen cross-linking. 44% of the total sample included between the age group of 25 to 30 years and 83% of eyes had compound myopic astigmatism. Coming to pre-op parameters, the pachymetry, 48% had central corneal thickness of 450 to 475 micrometer and 52% sample has steep K above 46 diopters with a suspicious topography. Intraoperatively, average stromal thickness was measured and about 55% had stromal thickness in range of 351 to 400 micrometer. And a refractive outcome, 96% had post-op uncorrected visual acuity, same as of preoperative best corrected visual acuity. And about 21% had stromal haze in 6-month follow-up but not affecting the vision. Coming to discussion, our study included 29 eyes and we found that the stabilizing effect of refraction and it is a safe procedure. These are the 2 last studies done by Brar et al. And Farhad Hafizi et al. In Brar et al, 294 eyes are studied and they also found combined refractive surgery and simultaneous collagen cross-linking is generally safe and effective, and it also stabilizes refractive and keratometric outcomes in patient. Farhad Hafizi et al. Study also shows it is safe, efficacious and very good refractive results and stabilizing effect of refraction, and no eyes had significant corneal haze at 12-month post-op. Nelopoulos et al. Also found a safe and effective adjunctive treatment for refractive regression and potential ectasia. Hanley et al. Study showed a transepithelial PRK combined with prophylactic corneal collagen cross-linking, and it is also found significantly reduced the magnitude of displacement of peripheral and central posterior corneal surface. So, the study provided evidence for effectiveness of TransPRK extra in stabilizing cornea despite a significant decrease in corneal thickness. It may not always feasible to perform flap-based refractive procedures in thin corneas with suspicious topography. So, TransPRK extra may be a safe and effective solution which gives an added advantage in high-risk cases. These are my references. Thank you.
You had op scan or pentacam?
Pentacam.
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 Pentacam, okay. Any epithelial topography alone you have done or not? Because you told epithelial you have to remove the epithelium and then do the PRK,
Yes,
no?
yes, sir.
Did you find out any epithelial topography, those patients? Epithelium
No.
alone, whether it is thinned out or something like that? No.
No, sir.
No.
This is done on suspected keratoconus or all thin cornea?
Thin corneas, sir.
Thin corneas, not
Not
suspected.
suspect keratoconus.
Sorry, what was the follow-up period for this study?
6 months.
6 months. totally 6 months.
Only 6.
But you found 21% having corneal opacity without affecting the
Vision.
vision. So the other study shown 12 months, no
12 months.
12, no corneal opacity.
Yes, sir.
So these type of things, do you think that 6 months is enough to have a conclusion?
No, sir.
Okay, thank you.
Okay.